Let's continue with the deeper structures of the lateral and posterior lateral aspect of the knee. Notice in this illustration that the iliotibial band and the biceps complex have been removed. Let's begin with the fibular collateral ligament. The fibular collateral ligament starts at the lateral epicondyle of the distal femur and inserts onto the fibular head. Notice the insertion onto the fibular head is somewhat distal and anterior. The insertion is 28 millimeters distal to the fibular styloid and just 8 millimeters from the anterior cortex of the fibular head. Deep to the FCL is the popliteus complex. The popliteus complex begins with the popliteus muscle, which originates on the posterior aspect of the tibia. This then continues in a proximal and lateral direction, runs near the fibular head, and then becomes tendinous and inserts just distal to the fibular collateral ligament on the lateral aspect of the distal femur. At its musculotendinous junction, the popliteofibular ligament connects the popliteus complex to the fibular head. The FCL and the popliteus complex are the key structures in a posterior lateral knee reconstruction. Let's continue with the video dissection. The FCL can be visualized with a window through the anterior arm and the long head of the biceps, which has been previously created. We reflect back the anterior arm, showing the cord-like structure of the fibular collateral ligament. We will now move to a closer view of the lateral knee ligaments. An important landmark is the lateral head of the gastrocnemius, which is on the left of your screen. The lateral head of the gastrocnemius is commonly spared even in severe posterior lateral knee injuries, thus can be an important landmark when doing a repair or reconstruction. Note that it is very adherent to the posterior capsule of the knee. The fibular collateral ligament shown here again begins on the lateral epicondyle of the distal femur. It then extends distally to insert on the distal and anterior aspect of the fibular head. Notice the fibular styloid here. Its insertion is 28 millimeters distal to the fibular styloid and just 8 millimeters off the anterior cortex of the fibular head. Deep to the FCL is the popliteus complex. The popliteus tendon, shown here, inserts just distal to the FCL. The popliteus muscle originates on the posterior aspect of the knee, and at its musculotendinous junction is seen the popliteofibular ligament. The popliteus tendon then continues and inserts on the lateral aspect of the distal femur. This is commonly reconstructed and/or repaired in a posterior lateral knee injury. The FCL, the popliteus tendon, and again the popliteofibular ligament shown here inserting on the fibular styloid. Notice in this specimen how stout the popliteofibular ligament is. Also note the sulcus that the popliteus tendon falls into with knee flexion. The sulcus is shown here. Flexing the knee past approximately 110 degrees allows the tendon to fall into the sulcus. Also notice with knee flexion how prominent the popliteofibular ligament is in the specimen.